There we go. Good morning, everyone. We're going to just sort of wait while everybody is being added to the webinar. And my name is Dr. Andra Davis, and I'd like to welcome you to our February installation of the Innovations in Palliative Care Education series. And my colleague is here, Dr. Megan Lippy, there we go. And she and I are afforded the opportunity to do these webinars through a Cambia Health Foundation grant that we are on. So I wanted to ask that I see some familiar names here and new names as well, at least new to me. If you all wouldn't mind, we love to hear where you're coming and joining us from. If you could put that follow suit with Mary Allen here, who is greeting us from California, and let us know where you're coming from. That would be great. We love to just sort of see where everybody is. We have a couple, I see some folks from my own school, which is really wonderful because today we are sort of showcasing the experience of palliative care education through the lens of students. I also would like for one of my colleagues here, to pop in the chat the Faculty Corner link, because that is where you can find all of we've been doing these webinars for 3+ years. And you can find those on the Faculty Corner. You're might have to zip past, because there it is. Ryan posted it. So if you're interested in seeing what we're up to, what we've been up to, I invite you to join us over there for those, among many other resources that are on the Faculty Corner. So we have a lot of West Coast people I'm seeing. Oh, and then we have Durham, Seattle, Maryland. Okay. Lots of Miami.
Workshop participants from last summer who joined.
Oh,
I see some familiar names. So
awesome. Awesome.
Workshops.
We'll talk about that a little bit later. I just saw Layla's name pop up. So welcome, everyone. Again, my name is Dr. Andra Davis. I am at the University of Portland, and Dr. Lippy is at UT San Antonio. And again, we do this work through support from a grant through Cambia Health Foundation. So you should be able to see the screen. We're super excited and honored, really, to have the precious time of juniors and seniors, right? Like, these folks work, they go to school full time, and they have agreed to join us today to share a little bit of their reflections about palliative care and end-of-life education. So, full disclosure, we don't know what they're going to say, but we did give some prompts for them to contemplate and consider. So we'll turn to that in just a minute, but we thought that we would start here by sharing a little bit about kind of what our objectives are. Let me just nod to the names, and you all can wave out there, and we'll hear from them a little bit later. Rosemary is probably not here because, as many of you know, their capstone started, and so they are in clinical, and whether or not they'll be able to step away for a little bit, they may join us. But Christina is here. There, one of our seniors, Sophia Webster. And we will be, those of you there's a lot of names on here. So Ben will be joining us as soon as his class is over. So that should hit right at the time we're ready to engage in some dialogue with them. So, and then my buddy and colleague, my friend and colleague, Christine Ducart Harrington, who is an oncology palliative care nurse. There, she just waved. And someone that I'm privileged to have worked with at University of Portland not that long ago. And we are going to, let me advance the slides here. We have a lot of objectives for 1 hour, but I promise we'll get through them all. So we're going to share just a high level kind of what does palliative care formally sort of look like in our curriculum at University of Portland School of Nursing and Health Innovations, and share some personal insights and reflections about how this education is shaping students' understanding and integration into their practice. As it is at this point as senior nursing students. And then we really hope to facilitate a dialogue with all of you. And we are so grateful that you all are here today to hear from the students and just kind of hear about what are some effective teaching strategies that you're using. We'll hear from the students about ways that we can facilitate their learning and navigating ethical and emotional challenges in with such subjects, and then discuss strategies to enhance not only their knowledge, competence, and emotional resilience in caring for people with serious illness. Now, before we do a little bit of hearing from them, Dr. Dukart Harrington is going to share a little bit from the literature about what we know from the student perspective.
Thanks, Andra. We wanted to share just a couple of pieces of the literature that spoke to the student perspective on palliative care education and nursing. This first study was done by our colleagues at University of Portland, kind of examining how students felt about the ELNEC modules, the use of the ELNEC modules and palliative care education in general. This was published in early 2020, right before the pandemic. And it was based on the first few years of integration of the ELNEC modules across our curriculum. And I'm not going to read them to you, but it just kind of highlighted the desire for students to take the ELNEC modules and really bring them to life in the classroom as well. Have engaged professors, have intentional threading of the content across our curriculum. And that really informed our own curriculum design and redesign as we move towards a concept-based curriculum in our undergraduate program. And then I think we can advance to the next slide. The other article we wanted to highlight was a systematic review by Lee and colleagues, and they looked at about 30 some articles about palliative care nursing education and just kind of picked out some themes around what students needed from their palliative care training and education. So these were some of the things that stood out to them. The key ones being comfort and support as they explored some difficult themes and difficult topics, talking a lot about symptom management and the nurse's role. Understanding the difference between palliative care and end-of-life care was key, and then understanding the nurse's role in palliative care and scope of practice. So those were kind of inspiration for some of the work that University of Portland has been doing over the past several years, and the basis for an elective that Andra and I worked on and offered a few years ago. So I think Andra's going to speak to integration of palliative care across the whole curriculum, and then we'll hone in on the elective.
Great, thank you. I also want to call out if you're interested in sharing a little more insight, my colleagues that are on the call that are key, constituents in this, in teaching this across our program. So the next slide here is really just a big picture look at how we sort of formally integrate the ELNEC modules and as well as simulation experiences across our curriculum. So this slide, you can see on the left-hand side, we have an unfolding case that the students are introduced to this individual as juniors. And actually, the students can correct me if I've gotten something wrong here too, because I'm not involved in that simulation, but they meet this individual and I think the family as juniors in a home visit, during a home visit. And this person has a chronic condition. And over the course of the their education, subsequent semesters, they introduce the idea of palliative care again during a home visit, explain what that is to the family. There's a caregiver meeting, and then this patient goes on to be hospitalized, and then senior this semester. I mean, I don't know if you've had this or not. I might be blowing it, but the patient dies, and they participate in the care at the end of life and postmortem care as well. So that's sort of a beautiful sort of unfolding case that happens from senior through semester 2 seniors, from junior through senior semester 2. And then for our ELNEC courses, the curriculum, the modules, we have here at University of Portland, we have a death and suffering course that all nursing students take. And one of the modules is introduced in that course. And then senior level 2 this semester, the students in the chronic illness course complete, and I believe just have recently finished the other 5 modules in that course. And then there's activities and things that happen in that class related to those modules. So I'm going to pause for a second and see if any of my colleagues on the call here have anything else they'd like to add. Nope. Okay, so I must have done okay. And I'm really happy to say that there are many of us that care at my school that care about this type of this part of education. Ooh, come on. Okay, now we're going to hear about the elective that we put together a couple of years ago.
So Andra and I have been talking about doing this for a while, and we were able to access a grant, an internal grant through University of Portland to help us with developing this course. And we wanted it to be focused on the interdisciplinary nature of palliative care. So we offered it to all undergraduates across the University of Portland. Overwhelmingly, it was nursing students who ended up registering. I think we had one student who was a biology major and was pre-med. But we wanted to really have the students capture how interdisciplinary and multidisciplinary palliative care truly is. And so that was one of the aims of the course. And this slide really just kind of outlines the different activities that we engaged in throughout the semester. We tried to do a combination of in-person learning, some asynchronous work, and some online learning. We were able to subscribe, thanks to the grant, to the Center to Advance Palliative Care and utilize some of their online modules to enhance the students' learning. We also had the students pick a book written by a layperson, not a clinician, about the experience of living with chronic illness or facing end of life, and kind of reflect on the experience of reading the book in relation to what they were learning in the class. We also had a number of guest speakers and panelists, including our own Betty Farrell, come to the class and share their wisdom with the students. And then the big kind of focal points of the course was the Death Cafe, and we'll talk a little bit more about that on the next slide. But that was kind of the big assignment of the class, was to have the students organize and facilitate a death cafe. And hopefully they'll get a chance to share their experiences with you during the question and answer session. But it was a really fun course to teach. I think Andra is hoping to offer it again,
Yes,
even though I'm no longer
I actually
there.
I just heard Friday that it was approved. So we're offering it again in the fall. Yay. So yeah, I got to get a flyer together. Thank you, Christina, for doing flyers previously, and we'll get that out to everyone. There's Ben. Let's pause for a minute. And Ben, would you give us a wave there? Who is joining us after class?
Hi.
Hi. Okay. All right, I'll pop off to the next slide. Whoops, there we go. Isn't there another slide? Oh, I guess this one. This is, and you all that are that were involved, the three of them that are joining us today took this elective, as well as their nursing students, as Christine said, and they have received that sort of more global integration of palliative care education that we have for all students, but not all students obviously took the elective. But these are just a couple of pictures of the workshop. And I wondered, as we transition away from the slides, do any of the three of you want to say anything about the experience of crafting, organizing the event that was offered on campus? And we had a wonderful turnout, developing sort of the whole flow, the questions that were asked at the cafe and such. Do you want to offer anything about that experience before we transition to questions?
Yeah. I think I enjoyed it. It was just like a fun little project for us all to do. And it also forced us to look at palliative care in more of like a primary prevention type of way by initiating those like end of life conversations with people or students who are our age who really haven't, or at least the people I talked to hadn't really had those conversations yet or even thought about it. So it was cool to kind of watch them kind of unfold throughout the night and be the person to help initiate and facilitate those conversations as well.
Yeah, and something that we did is we had a gratitude tree, which I forget who came up with that. Was it you? Yeah, Ben came up with a gratitude tree, and it was something really beautiful to like close the night with, where everybody wrote something down where they were like, this is something that I want to take away from this conversation, because we don't really have these conversations on a day-to-day spectrum. And that, seeing that at the end, and you can see the picture right there, that was just like a really beautiful moment. And just like reading through everybody's gratitude cards.
In the planning process, also we had like cards as prompts of like, if you don't have anything to talk about, this is what you can kind of talk about. And they were ranked on levels of like, this might be easier to open the conversation with, this is a little bit more in depth, and this is going to be like a more hardcore question. And when we were doing that, we were like we were having a harder time because we were like, oh, this is easy to answer, like this isn't hard at all. But it was coming from the perspective of people who had been talking about death for weeks on end, and who had been surrounded by Andrea and Christine, who live in that life like that. That is their job, is dealing with people who are dying all the time. We were like, hold on, let's take a step back. Let's think about this from somebody who's coming in like, what's a death cafe? And then gets hammered by like, what's your deepest, darkest secret? And so we had to really remove ourselves and be like, oh, hold on, people don't talk about death every day. This isn't realistic. And so it put us like in a really interesting part of that. And it helped me to like think differently and realize that not everybody gets to think about death like that every day. And like the gratitude tree was also really interesting to read back. And at the end of the night, we kind of looked through it and we were like, wow, people really did put thought into this, and they really actually took something away from this. And I really enjoyed the whole experience, not just like the actual event, like the whole planning and the aftermath was very involved.
There's a question. I'm super happy to see that, because I wanted to pause for a minute and see if the audience had any questions at this point. And Helen Bradley has asked, would you recommend a death cafe for your family or friends? I'll just say one thing about that. I have a colleague at my school who recently adapted that for her neighborhood. And so she has quite a tight-knit neighborhood, and they did a death cafe in their neighborhood. Anybody have other thoughts?
Just to add on, me and Christina also went to Sule's Death Cafe when I was a freshman.
Mm.
And I think death cafes are really cool because like compared to the way like the one we went, hers was like way more organic in the sense where like maybe there was like a vague conversation starter, but he kind of just took it where it went, versus ours. I think we're more structured.
Yeah.
So you have a lot of creative freedom when you're organizing a death cafe based off your audience and your community.
For sure. I think also like gauging the people in your life like I have family members who do not like to talk about death at all. So I don't think they would really glean anything out of a death cafe unless they were actually willing to talk about the topics that were discussed. But like Ben said, like it just really depends on the death cafe you go to. And I think with ours, because it was more structured, we knew that people who were probably not as accompanied to talking about death, they were going to come and join. So we just wanted to keep that structure there too. But the one that we went to in a neighborhood with like people who kind of knew each other, it was a lot more organic, like Ben said, and they were able to like really facilitate those conversations together because they felt more comfortable with one another.
Thank you both. We probably should step back for just a second and Christine put a link to death cafes if you are not familiar with what those are. And they can look a variety of different ways. People post when they have one in different regions. And another one of my colleagues here mentioned that during clinical, they used to take students to a death cafe and they could get clinical hours. So you could find them in your local area, maybe through the website. And it really is a place where you just have conversation and tea around death and dying topics.
I think we posted ours to like the local death cafe website because we all one of the coolest things that I thought happened was that we had two older gentlemen from our like local area who just showed up and they were like, yeah, we called and we asked if we could come and we were told no, but we thought we'd show up anyway because what's the worst that can happen? It's a pretty welcoming event. And we were like, yeah, of course, like we'd love to have you here. This is like the best thing ever. We wanted local people to show up. We wanted people not from our like university to show up. And they said that this like our death cafe was obviously different than the ones that they had been to, but if we had another one, they'd love to show up again. And that's exactly what we wanted. We wanted people from the community to show up, not just people from our university.
We'll be doing it again this fall. So I'm going to stop sharing now. And Christine, do you want to, and keep the questions coming or comments in the chat, but Christine, do you want to begin? Again, just for those of you that joined us a little bit later, we crafted some questions for the students to reflect on and craft a response. But we don't know what they're going to say. So that's as far as it goes. So we're going to now hear from the students about their experience. And I'll let you start.
Okay, I think the first question we were going to discuss was asking the students to describe a moment in your palliative or end-of-life education that was particularly impactful for you.
I can go ahead and answer that one. I kind of wrote out all of my answers on a doc, so I'll be reading them. But this is specifically about the simulation that Andra was talking about in the beginning. So in our junior year, we have a patient. He's like kind of a patient because he's the family of somebody who is experiencing that chronic illness. And so the patient Jay, he was a caregiver for his mother who was diagnosed with lung cancer. And we acted as a clinical nurse resource. So when talking to Jay, he expressed that even though he was caring for his mother, he often felt like there was a distance growing between them and that her illness was taking more and more from her each day, like a lack of appetite. And then she was also growing distant from him emotionally. And so Jay also expressed that he was experiencing stress from the caregiving and his job. So he wanted to focus on ways to cope with that stress in the simulation. That was kind of like the focus of the simulation. And so I had just started in Andrea and Christine's palliative care elective, and we had like briefly covered the importance of open-end questions. So I asked Jay to answer some of these questions, and they were similar to tell me about some of your favorite memories with your mother. What has your mother liked to eat in the past? Before your mother was sick, how would you best de-stress as well? And Jay told me that his mother taught him how to cook and they would spend like hours together in the kitchen. And there was a specific recipe they liked to make, which was baked ziti, and because it was her favorite meal. And he also used cooking to de-stress and be present in the moment. So after listening to his answers, I like provided my perspective, which was something along the lines of like, I heard your stories and your mom has taught you a lot about cooking and it seems like a safe space for the both of you. And because you're worried about your mom's appetite, maybe a way that you can practice self-care and de-stress is make your mom's baked ziti, and it could also possibly entice her to participate in a meal. And it was a really special moment because he looked back at me, and even though this was a simulation, it was a very like palpable moment, and he looked back at me and said that sounds really good, like that sounds like a really good idea. So it was nice to see how a simple solution could impact somebody so much, and it made me realize like this is the reason why I want to get into nursing, is providing those simple solutions in my head, but it can provide so much impact to somebody and their loved ones.
Thank you so much for that. I want to just add a tad little bit for folks to clarify. We have actors in our sim. So this was a real person that you were having the dialogue with, just for context. And the other thing I really appreciate about that is just tapping into something as simple as an open-ended question, as a way to lean in and begin some sort of engagement with that person that was meaningful. So thank you. Sophia, were you going to share here, or should we go on to another question?
I think we can go on. I do have something to share a little bit later, though.
Okay. Okay, let's see here. So here's another question, and this really is around bridging the gap between classroom and practice. And the question is, were there moments when you might have felt unprepared or unsure about how to apply what you were learning, and what would have helped?
I can go. I felt, well, first off, there's also a question about kind of what helped, and I think the CAPC modules really helped in initiating those conversations. But when I've been hesitant in clinical practice is like after the palliative care team comes in and I'm like going in to like do my vitals or like give my meds, and I could just tell that this veteran was just like kind of distraught and like taken aback after having like 5 palliative care practitioners just like circle his bed and have that first conversation, which I don't think was something he was expecting out of his hospital visit. So I kind of had trouble just like debriefing that experience for him. So maybe like looking at it in the scope of like more of the bedside nurse who's not or doesn't have that primary palliative care role, and like how can we be of assistance to the palliative care team and further that conversation, or kind of help find ways to make the patient more comfortable in having those conversations is something I think, yeah, I didn't feel as comfortable in.
Right. And so the more sense of comfort that you have, the easier it is to lean into that. Thank you, Ben. Christine?
Thanks, Ben. I know those inpatient palliative care visits can be really intense and long. So I appreciate you sharing the perspective of the person who comes in afterwards and has to kind of help provide support and sometimes pick up the pieces of whatever just happened in the room. So thank you. The other question we had kind of about bridging the gap between classroom and practice was if any of you all had real world situations in clinical where you felt like what you learned in the classroom, either the elective or the course itself. Sorry, my dog just decided to join me. To how your classroom experiences informed your clinical practice.
And yes, I do want one little reminder for all of you is you can draw on anything that we've done in the curriculum, not just the palliative care elective.
I can share. I had an experience, my senior capstone is in the ICU, and I had an experience where my patient declined really quickly, and the provider had just left the bedside, and then he had been on BiPAP, and family came bedside, and then he was like, I'm doing pretty well. Can we like take the BiPAP off? And so we consulted with RT and decided that he could be moved down to a non-rebreather while family was there so we could talk with them. And then we had taken it off briefly to give some medications. And I was like, okay, like, let's put the non-rebreather back on. Your oxygen's not doing too well. He was like, no, I'm ready to die. And it was just me in there because my preceptor had stepped out of the room. And I was like, oh, okay, like, this is pretty intense. Like, it's just me. I'm just the student and your family's there. And I was like, okay, like, that's perfectly okay. You're allowed to make those decisions, but we just need to make a plan. Like, we can't just go right here, right now. And his family was really understanding, and they were like, we are going to support you, Dad, but we just need to make a plan. And so I stepped out of the room, I grabbed my preceptor, we decided what we were going to do, and we went back in together. And my preceptor was like, so I hear you're saying you want to die right now. And he's like, yeah, that's what I want. And we were both just kind of standing there because the doctor didn't want to come back bedside right then because she had just been in there. And so we were trying to clarify what he needed and what he was wanting to do. And I was just kind of stumped, and I was like racking through my brain. I was like, okay, what can I say right now? And because of the palliative care class I had taken, and because of, working with Andra and Christine, I was like, I have words I can use. And so I was like, what does that look like for you? What does saying I want to die mean? And I was like, so does that mean you want to take down all these medications, all these antibiotics and all the drips you have going? Does that mean you want to remove all the lines you have? Like, what does that look like? And he was able to clarify that, and he was able to say, I want my family to witness this. I want everybody who wants to witness this to witness what is happening right now. And we were able to clarify his goals really quickly and able to have that happen for him as fast as possible. And he ended up passing within 5 hours of saying he wanted to die, with his family surrounding him and just giving him all the love he wanted. Like, it was truly a picture perfect scene in palliative care of what you would want for somebody to happen. And I felt really like grateful that I was able to witness that, but I also felt like I wouldn't have been prepared without a class like this, because regular nursing school does not touch on it. And so I think that this palliative care class truly prepared me for that better than anything else would have.
Wow, first day. Again, going back to Ben's comment, getting comfortable and being okay being in those spaces with people. Thank you, Lena. What a testament. Yeah, that's quite a story. And we are very proud of you and all of you. Anyone else should we move on, or?
I can also answer that question.
Okay.
So I felt like a lot of my coursework, both the elective and the classes before, had prepared me well for like experiencing the emotional support role around palliative care and the dying process. So I had a clinical rotation for my acute care rotation on a medical oncology floor. And one patient on our care load was a comfort care patient who was expected to die in the next couple of days. And the nurse I was shadowing, she told me that I didn't have to go in the patient's room if I was uncomfortable. I didn't have to participate in his care, but I told her I was actually really okay with it. And I had an interest in palliative care and hospice. So I joined her, and we talked to the patient's sister, and we had a long conversation with her. And I just kind of sat as a presence for her during this time. And she opened up to us a lot about what was challenging, but she also expressed that it felt really good to have the nurses just sit and talk with her, because not a lot of the nurses would sit and talk with her and talk about her grief and the emotions that she was feeling. And so after our conversation, it was only like 20 minutes, but after our conversation, my preceptor for that day said that I did really well in that situation. And it was something that she doesn't see often, especially with students. And then a different day, I was able to shadow a palliative care physician, and I spent about half a shift listening to his conversations with like potential clients. And during every conversation, I saw like everything we had talked about with communication literally like manifest before me. I was with him and a social worker.
Mm.
And something that he said that has stuck with me is that nearly 3/4 of providers interrupt their patients within like the first 6 seconds of their visit. And so he insists that he let all of his patients finish their statements. And then he also waits like 3 seconds after they finish their statement, ensuring that he listens to their statement fully. And I still bring that with me in like every one of my clinical shifts because I think that's just super important because we see the pace as like nursing students, we're kind of shocked by the pace of bedside nursing, where it's just like go, 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 go. You have all your tasks and then you finish it and then you have to leave because you have other patients. But I feel like being able to have that presence, even just as a nursing student, is one of my strengths. And I've learned it through all of my palliative care coursework at UP.
Beautiful. You are not just a nursing student, by the way. Let's get rid of that word.
Thank you. Thanks for the reminder.
There's a question here that I wonder if it's a good time to pause and have you think about in the chat. Do you think that having and it would be really interesting because there's different schools do different things, right? About whether or not you integrate palliative care early. And in this question in particular, it's about having a palliative care course early in the education. Would that be advantageous? Ellen Bradley has asked that question. So curious about both the students' perspective on that and those of you here.
I actually was going to touch on this a little bit later because I know that we were going to talk about anything that you would change to palliative care. And my response was going to be, I feel like it should be taught earlier and also interwoven through all of our courses. I feel like it's brought up a lot later in our nursing. At University of Portland, we get a class called Theology of Suffering and Death in your second semester of junior year, and it touches on different like theological approaches to nursing as well as the palliative care aspect of it. And it's a really beneficial class, but I feel like having something a little bit less intense earlier on gets people used to what palliative care is so that they're less hardened to palliative care early on in the nursing career. And I just feel like that might be beneficial to like early on, like young nursing students.
Yeah, I agree with Sophia. I took the palliative care class my sophomore year, and at UP, we're a concept-based curriculum. So in the class that I was taking for that semester, one of the concepts was communication. So it was easy for me to draw connections between what we were learning in the palliative care class and in our communication concepts. And I felt that it was easy for me to apply that in our population health clinical and in our simulations because a lot of those simulations are really just identifying ways to empower your patients and like connecting with resources. So just having that kind of background knowledge of like ways to tease out information from your patients, and that's not like a yes or no or like a simple screening, was really beneficial for me. Even though it wasn't like directly palliative care related in every single scenario.
Yeah, and you really are speaking to sort of the threading of palliative care concepts in so many other parts of nursing practice.
Yeah, I was also going to answer this question later on, but I have a very similar perspective. I feel like palliative care is an excellent introduction for nursing students to begin thinking about how they want to listen to their patients. And then by listening to their patients, then they can figure out how to advocate for their patients. And so I really wish that palliative care could be talked about earlier on in nursing school. I feel like the palliative care education I've received has just made me a better listener and communicator, not only in like my professional life and my clinicals, but also my personal life and the people that I care about. And I feel like when we come to college, we think about all of the didactic courses that we're going to like take like anatomy and physiology and then pathophys, but I feel like a lot of the most important things that you learn is how to be a good communicator. So starting young not only helps your patients, but it also helps yourself in the future.
Thank you. Megan has stated a position on it. It sounds like knowing what to say. You can get on if you want to share, Megan. Or you want me to just read it? What to say is a critical, like the communication piece. There she is.
Yeah, I just, listening across the students, they've shared where they've wanted to know what to say, but also where knowing what to say has been so poignant in the care they provide. And then, wishing it was earlier. And so it's just kind of, just sitting, reflecting what I'm hearing. It's like, well, I think we have a responsibility then to help them from day one, what is it that I say? And that this communication, and it's really therapeutic communication, and from a palliative care lens specifically, should be moved much earlier in the program. Because even if they might not know some of the complex symptom management, those sorts of things, just knowing how to talk to patients and being silent, and not just telling them go be silent and be present, but actually giving them the opportunities to cultivate those skills, I think would really change that trajectory and get, because from day one, their first patient might be somebody that they need that skill set for. So how are we helping give them those words from day one?
Thank you. I wonder if we might think about a couple questions around teaching, and where you all are bravely speaking to a bunch of educators here. So thank you. And I wonder if you might, one of the kind of topical areas is innovations in teaching palliative care. And what if you were to change one thing about how palliative care is taught in nursing programs, what might that be? And maybe you could elaborate a little bit.
I would say more hands-on learning. To preface, I'm in the theology class that they were kind of talking about, but within the past year, it's switched from like a theological emphasis to a nursing emphasis. So it's no longer like tests, exams, and papers. It's kind of just learning how to talk to people. And I feel like throughout nursing school, it's a lot of exams and papers, but we don't always get the opportunity to like put the computer away and just like make eye contact with someone and practice how to have those hard and uncomfortable conversations. So just allowing for more time and like moments for us to practice and mess up and know kind of how we feel and to navigate our own feelings of discomfort, while also being there to support the people we're working with as well.
Oh, that's well said, Ben.
Thank you.
Other ideas?
I feel like this might sound a bit harsh, but I feel like just kind
That's
of
okay.
making people get to that space of being uncomfortable. I feel like a lot of times we get a little bit coddled because we don't want to, like, we're still students. We don't want to make people feel uncomfortable, but sometimes, it's like, going back to that simulation that Christina talked about at the beginning, I know a lot of my classmates were like leaning on their partner, who felt more comfortable having that conversation, because we go into our simulations in pairs, and so we have somebody to lean on if we aren't super comfortable. And that's really helpful in simulation. And I'm not saying in simulation we should go in alone and be thrown into these really uncomfortable situations. But in a controlled, comfortable environment, I think there are situations where we just need to be thrown into those uncomfortable situations and have to learn something, because I think that's when we do our best learning. And I know that's harsh to say, but I just feel like that's how we learn things, especially in a controlled environment, because in the real world, something's going to happen and you're going to have to do it. And you would rather have to do it uncomfortably for the first time in a controlled, safe environment.
Thank you, Sophia.
If I could jump in, since you told me I can, I'm going to. And I don't remember if it was Sophia or Christina who said it, but one of you shared an experience where the nurse was like, well, you don't have to go in there if you don't want to, if you're not comfortable, right? And we see that a lot where, well, you don't have to go into those spaces, but the reality is, to be practice ready, they're going to have to be in those spaces when they enter practice. So again, it's that we would hope that our clinical faculty, working with our practice partners, are saying, please let our students go into these spaces, role model for them what this looks like, or allow them to have these conversations. But then also we have to recognize that that's the conversation that's being told to students. You don't have to go in there. You don't have to do that. You can excuse yourself from that experience. So then how does that shift to us making sure that we are facilitating those experiences for them to do and to say and to, even if it's
Mhm.
sim or in some other ways, but really taking that responsibility to ensure that it's happening, because we do recognize we'll have practice partners who, or preceptors who will say, you can skip that. So
Mm.
there's sort of that, I think, opportunity to make sure for multiple fronts that those students are getting experiences. But thanks for sharing that, you heard that. Like, oh, you don't have to go in there.
Mm.
Because
Mm.
that's very real, but not practice ready.
Practice.
I've also heard in clinical settings that students are going to be bored, quote unquote, by being assigned to care for a patient who's on comfort care, for example. And I would encourage faculty to kind of push back against that idea, and partner with clinical faculty to really think about how the students can embrace those opportunities. I would look for those opportunities for my students because I felt like it gave them a chance to practice communication skills, practice non-pharmacologic interventions, practice what it means to actually provide comfort. So I think kind of flipping the script on what it means to provide comfort care, I think, is an important part of this as well.
I wanted to invite anyone else here, faculty that are on, to comment here, and then I wanted to draw back to some of the comments in the chat. Does anyone have any thoughts about giving students permission to not go there? Or anything related to that? There was a comment, a question earlier on here around do schools integrate across the program or in multiple courses in their own or in one course. So the one thing that I think is helpful to know is that you can do it in a way that works for your program. And maybe people on here can share some different ways that they have been doing that. But somewhat related, I wanted to comment on a question that Layla posted to Ben, is around when you talk about more opportunities to practice, where do you mean? Like processing in the classroom or simulation? And I see, Christina, you or Ben wrote the answer there. You're on the same computer.
Yeah, Christina scribed it for me. But I think just like practicing, like, for example, 2 weeks ago in my theology class, I put in air quotes because it feels more like nursing based. But it was a scenario of like this mom had been recently diagnosed with like metastatic breast cancer, and the daughter didn't want like the physicians to tell the mom. And the scenario is like the daughter catches you in the hall and like asks you not to tell her mom. And you kind of just have to navigate, how do you do that? And we're like in groups of 3. So one person's the daughter, one person's the nurse, and then one person's observing. And the first time we go, like one of the girls in my group was just so uncomfortable, like she started to laugh. So I think just doing more of that role play so you have time to be uncomfortable and like and make those mistakes you probably wouldn't want to make in practice would be helpful.
Mm-hmm. I would add that I feel strongly that we need, and you're describing a didactic course in that case. I feel strongly that, if you're integrating the modules in different didactic courses, and honestly, they could be integrated into clinical courses, and you could unpack them in post-conference, for example. Like, it doesn't have to be in the classroom, but that we need to help students, back to Ben's point, practice. And so you might have them complete modules and turn in their certificate as sort of part of their credit in that course. But how are we, and it's just a question for all of us to think about, is how are we helping them with that practice of what that online module has sort of foundationally provided for them, but how do we unpack that in the classroom with them or wherever it is that we might unpack it? We'll come back, Renee. We'll come back to that movie night situation. Go ahead, Megan.
Yeah, I think it speaks to the need for multiple opportunities for this, because I think it was Ben, but I could have been wrong. One of the students mentioned in this image, the student who's most comfortable jumping in is the one speaking, which is fantastic, right? We want students to do that. But how do we then help the students who aren't comfortable have those opportunities? And so if it's just one sim one time, they got to see it role modeled by a peer, but that's not the same as them necessarily doing it. And so multiple touch points of them having opportunities to talk one-on-one where nobody's listening, just so they can get over the giggles and the discomfort, but then really scaffolding that throughout the curriculum. And then also when they're in clinical settings, how are we pre-briefing them? If we know a student's going to go into this room where there's a patient with serious illness or where there's this conversation that might occur, how do we pre-brief them? How do we kind of help them think about what are those things you could say ready in your pocket, like tell me more, some of those ready to go communication tools, and then debriefing them afterwards as well. Because there is that I think we have that responsibility to make sure how were you, how did you feel during that? And if there was discomfort, well, how can we lean in to help support you with navigating that discomfort so you're maybe a little bit more comfortable the next time around?
Mm-hmm. Which requires that we grow in our own skills and comfort in having those conversations as faculty. We have about 5 minutes left, and then we want to make a couple of announcements. So as I'm looking at the questions, Christine, is there something that pops out that you'd like to circle to, a call to action for nurse educators, maybe? Go for it.
Yeah, that was the one I was looking at as well. So I think I would love to hear from the students kind of what you would like us to know as nurse faculty about how to help ourselves and our peers best prepare students for this role and for providing good palliative care nursing, which I put in the chat. I think it's the same thing as good nursing. But I would just love to hear if you have any advice for us as educators.
I think a lot of when I like prepared my answers, a lot of what I was focused on was kind of what I've been talking about having the conversations. But I also think like showing palliative care in its whole like scope and not just connected to hospice, right? Like in the current class I'm in, palliative care and hospice are almost used interchangeably, or it's like first you're on palliative care and then you go to hospice. So looking at, yeah, exactly. So like looking at palliative care in like different settings, like, okay, maybe someone just got diagnosed with diabetes, or someone like you're working with a veteran who just had like an amputation, and applying palliative care in different environments, I think would be beneficial because it's also, I guess from experience, people are like, as or in your bachelor's, people are really focused on like bedside nursing and acute care nursing. Um, so I guess showing palliative care in different acute disciplines, but also showing it in like population health as well would have been cool to see.
For me, I know everybody hates it, but the most beneficial thing for me was like role-playing scenarios and like talking through it, because say like even if we were a little bit goofy because we were uncomfortable, role-playing it in class and like talking through those uncomfortable things made me feel more prepared for when it actually happened. Like when I did actually have to have those hard conversations, because I was like, wait, I've said this before. I know what I have to say and I know how to say it, even though it's uncomfortable and it's hard. Um, and so it made me feel more prepared. And then, shoot, I was going to say something else too. I was going somewhere too. Um, it was about what Ben was saying. Oh, yes. With patients who are like having chronic conditions, but they're not gonna die. Like everybody goes, oh, palliative care hospice. I was talking to Andra the other day actually about how everybody just goes, oh, if you're on palliative care, you're going to die. With where I work in a hospital right now, and a lot of my coworkers just tie palliative care to you're going to die. And we have a patient who has eventually it's going to be a terminal diagnosis, but she's not going to die right now. And everybody saw the palliative care consult in her chart and was like, oh gosh, she's just going to die. And I was like, no, guys, this patient isn't going to die, not anytime soon. Like, look, they've given her this like very long, like prognosis and everything. They're like, you don't know what you're talking about. Palliative care means she's going to die. And I just think that, like Ben said, people tie palliative care like right next to hospice, and just I think sometimes separating those two out is really beneficial so that people don't have that connection in their head.
We have a long way to go. And
Can
you help
Can I
champion.
hop in?
Dr. Lewis, please.
Oh, no, I definitely agree. Thank you so much for saying that because we have a long way to go. I can talk to individuals separately about what we do here in Miami, but we incorporate also the religious aspect. So we've incorporated different denominations because there's a gap between practice and our nursing students. And a lot of nurses right now, I'm a critical care nurse, but a lot of nurses have never experienced or been prepared for end of life and palliative care. So we're actually trying to educate future nurses as well as educate current nurses on what those dynamics entail. But excellent point. Sorry. That's it.
Awesome. Thank you for reinforcing that. You need to role model that and help change not only what's happening in nursing education, but also out in practice as you experience, Cynthia, as you shared. We have a couple of things I want to say, and then I'm going to just screen share for a second. Back to the idea of getting comfortable ourselves with this whole sphere. We have a workshop coming up. There was a message about it earlier in the call, a workshop for faculty that is to help kind of like expand. It's 2 days. And it expands on all these conversations about how can we now integrate this. Nikki made a comment about, oh, I have new ideas now, mostly situated in clinical. I have new ideas now. So how can we support each other in learning ways that we can do this in our roles as educators? So we are so happy to invite you to consider coming to our second workshop, which is this coming summer, July 24th and 25th. It is a workshop for faculty development in palliative care education. Applications are due April 1st. You're going to all receive these slides, so you'll be able to come back to this later if you want to. But it is sponsored. We have a sponsorship through Cunniff-Dixon Foundation, ELNEC, and the University of Portland School of Nursing and Health Innovation, so that this is largely grant funded. You apply and you can come, you get food and you get housing, and you get registration covered. So we really encourage you to consider this. 2 people from each school are invited to apply and attend. We have a new aspect of this workshop this summer. Is last year we did only undergraduate. This year we're doing graduate, welcoming graduate faculty as well. We have about 100 spots for undergrad faculty, and the phone goes off right then. About 50 for graduate. So please consider that. If you have any questions, Dr. Lippy and I are happy to help you clarify any questions. You just need to get yourself here. So more on that later. And as a final mention, if you like these webinars, they're free and we have them every month. And this is a link to register for next month's webinar, which is Fostering Compassion and Belonging in Palliative Care Nursing Education Through Language, Inclusive Language. So we have some colleagues from MGH Institute. I forget where that is, Megan. Where is that? Boston.
Yes.
And
Colleagues
they
from
will be, we rotate the days of the week and the times. So please join us if that sounds like it's of interest to you. And I want to stop there and one more time thank the students so much. 2 of them got off night shift. Okay. They work, they go to school, and they find time to share this. And I will assume it's out of their commitment and passion around what this has meant to them. So thank you all very much for being here. And any final comments or questions we have? Oh, we're done. Time's up.
You can always email us with questions or anything UP directly. Reach out to Dr. Davis. Our contact info is on our ELNEC Faculty Corner. So you can, or just email elnec@coh.org. They'll get it to us.
They'll put you with us. All right, students, look at
y'all.
all the thank yous coming in the, thank you all so much. Have a wonderful day.